Hello, thank you for joining us on today's webinar featuring the topic of payment plans. In today's video, we will go over the following: understanding the definition of a payment plan and what each payment plan type is going to be best utilized for, how to create a basic patient payment plan, how to create an insurance payment plan, as well as how to use the insurance payment plan in conjunction with the patient payment plan. Also, we will go over how to create and utilize the dynamic payment plan and how this differs from a regular patient payment plan. For all of these payment plans, I will show you how to create and attach a payment to each of them. And the last thing that we'll cover is how to close out a payment plan once the payment plan has been paid off and is no longer needing to be used. So for the definition of a payment plan is a loan against the office for the patient. When you're creating a payment plan, you are crediting the patient's account in the ledger for the amount of the treatment being applied to the payment plan. So let's go ahead and get started with our first example so you can see it in action. A basic patient payment plan. So here I have my test patient pulled up here, Peter, patient. And we have a couple of procedures on his account here. We have an insurance estimate pending showing us that insurance will likely pay $250, but that Peter still owes us $750. We're wanting to have Peter pay this balance down over the course of many months, so we'll go ahead and set up for Peter a patient payment plan. Above, we'll go ahead and select the payment plan button, and from the drop-down, select Patient Payment Plan. This is our Patient Payment Plan window here, and we're going to do all the customization on the left. Starting with the category. If you'd like, you can set it up in your database so that you have different categories to organize your payment plans. I don't have any currently set though, so I'm not going to change that from the drop-down. We do have our patient listed here, Peter patient, who is the person whose treatment we're paying towards, and below that, our guarantor. Now, the guarantor of a payment plan is going to be the person responsible for paying towards that treatment. So it may be the patient listed, or it may be somebody else in the family's account, of course. If we need to change that, we can select the Change button here, and choose from a patient in our database that will be the true guarantor, the person paying towards that treatment on this payment plan. Peter's going to be paying for himself in this case though, so I'm just going to go ahead and cancel out of this window. Below, if we needed to make any adjustments, we could adjust who the provider and the clinic is the default to, but the defaults will be whoever is listed for this patient, so his default primary provider and the clinic that he is currently seen at. So by default, what we're seeing here under the total amount for our payment plan is going to be that total balance that this patient has currently. So just for reference, this is back here under the total column. We know, however, that insurance is estimated to pay $250, and for this payment plan we're creating, we really only want it to be a $750 payment plan. So we'll go ahead and adjust that amount now. Now I want to direct your attention down here to the View Treatment Credits button, almost at the bottom of this page. What we're doing when we're creating this payment plan is we're creating essentially a payment plan towards certain procedures. At this point, if we left just this dollar amount here, we would be creating a payment plan for $750, but it doesn't really specify what it's going towards. To specify the treatment we're wanting to apply the $750 to, we're going to want to click onto the View Treatment Credits button. From here, we can notate which procedures we're wanting to attach to our patient's payment plan. You have the ability to select completed or treatment plan procedures, and you can tell the difference between them based off of the status that we see here. So Seek for complete and TP for treatment plan. At this time, Peter is going to be paying for procedures that have already been completed. It's going to be these top two ones here. So I'm just going to go ahead and highlight them by shift selecting both procedures. And then over here on the right, I'll go ahead and hit the Add button. Selecting OK, we'll add these two procedures to our payment plan, and down below you can verify that the total credits attached match what we had previously listed in our total treatment plan amount. Everything looks good in this window here, so I can go ahead and hit OK. But if I needed to fine-tune or customize it, I could of course click on the procedures, remove them, or add a different one instead. All right, so our total amount here matches the total treatment amount. At this point, we can go ahead and finish off the terms of our agreement here. The date of agreement by default will be today's date. But if I needed to backdate this, I could of course do that as well, if maybe this was something that we had agreed upon yesterday, but I hadn't got the chance to set up until today. The date of the first payment listed here is going to be the date of the first automatic charge on this account. So whenever we're charging their first monthly payment. If we're taking a down payment today, we're not going to list today's date. This is going to be whenever we want their next charge to be due. So I want every charge to come out on the first of the month. So I'm just going to change that date here so it's for May 1st. We are going to go ahead and take a down payment today of $150 here. So I'm just going to go ahead and list that here as well. Below, we have the ability to set an annual percentage rate if we intend to collect interest on this payment plan. But for this patient, I'm just going to go ahead and leave it at 0. All right, so now with our terms set here, we can go ahead and set up our schedule here. We can choose either the number of payments we want our patient to pay or a specific dollar amount that we know that they'll be paying towards. In this case, my patient and I have agreed that he'll be paying every month $100 towards our office. Once an entry has been placed in either of these boxes, you can go ahead and create the schedule. By default, when we create the schedule, it's going to populate a monthly schedule for us to go off of. If we want to customize that further, we can click on the More Options button. And this allows us to choose alternative options for when each charge will be posted on the patient's account. So if we wanted to, we could set it to be weekly, bi-weekly, the first specific day of the month, monthly, or quarterly. Monthly works for my patient though, so I'm just going to go ahead and close this window and leave it as the default. All right, so with everything set here on the left appropriately, I can go ahead and create our schedule and we'll review that together. So here's our amortization schedule. What we're seeing here is a date for each of the upcoming payments. We have a down payment that we notated of being $150 listed for today's date. So due at this time, we have $150. Future payments though, due on the first of the month, only show that they will be due $100 just as I had specified. The patient will be paying a total of 7 payments ending in October, and that is when the complete $750 balance will finally be paid. If everything looks good, we can go ahead and hit OK. Our notes down here at the bottom specify everything that we just went over. If we'd like, we can print out this agreement here so that the patient has a copy for their records. And at this point, we can go ahead and hit OK. Now, as you can see, that balance, which we previously had at $750, now shows at $150. This is because we've removed the entirety of their balance, the $750 they owed, and placed it up here in the payment plan section. However, they still owe us that down payment of $150, which we listed as being due today. So that shows here in this final column as due now, the $150. So we'll just review this information here under the payment plan section real quick. It recaps our payment plan that we just set up. The date of agreement shows us 4/6. The guarantor or person paying towards our payment plan is Peter Patient. The patient whose treatment this belongs to is also Peter Patient. The type of payment plan is just a basic patient payment plan. We didn't specify that it belonged to any type of category. The principal amount that they're paying towards and the total cost in this case, because we're not setting up an APR percentage rate, is still the same at $750. Currently, they've paid $0 towards their payment plan, and the total balance is $750 because they've paid nothing so far. However, they do owe us that down payment of $150 at this time. All right, so let's go ahead and collect that down payment. To do so, we're just going to go up to our upper left-hand corner and select the payment button. We'll enter in our down payment amount of $150 and hit OK. This window appears here, and as you can see down here in our payment splits, it's automatically deduced the fact that it needs to apply this payment to the payment plan itself, listing it as a pay plan charge. I'll go ahead and just notate that this is a credit card payment here and hit OK. The patient's balance is currently $0. They've paid everything that is due currently. On the 1st of next month, you'll see that their balance will be $100 because that is how I've set my payment plan to show. On the 1st of this month, the patient's balance will go up by $100, which will be the amount that is due at that time, and will continue to be the same for each additional month, charging them $100 on the 1st, just like I had specified. So that's the basics of a patient payment plan. Let's go ahead and take a look at another example in which we're dealing with an insurance payment plan. So I'm going to go ahead and pull up my next example patient here. Anita Insurance. In this example, Anita has had some orthodontic treatment completed. An insurance payment plan is perfect for this situation. This situation is that the insurance carrier will be sending payments in installments, such as quarterly payments towards her ortho work. What we're wanting to do is remove the insurance carrier's portion of the outstanding balance from the patient's account so that we can separate the fact that insurance will be eventually paying us $2,500 and the patient will eventually be paying us $2,500. When I access Anita's account, I only want to see what the patient's estimated balance is. For an insurance payment plan, once the plan is closed, any difference between whatever the original payment plan charge amount was and what insurance actually did pay will be moved to the patient ledger. So if I create an insurance payment plan for $2,500, but insurance only ever pays us $2,000, that remaining $500 will be moved to the patient's ledger after I close that payment plan. So let's go ahead and get started with this example. Again, we're going to go up to the top and select Payment Plan. From the drop-down, we'll select our last option for Insurance Payment Plan. All right, so today's the day that we've received our initial payment from our insurance carrier here, and they're paying us $250 towards the work that we've done on this patient. So setting up this insurance payment plan, again, we can go ahead and specify everything here on the left-hand side, starting with the category if we have one. Confirmed, Anita is the patient that we are working on, so I don't need to change that here. There's not an option to set a guarantor on this account because a patient will not be paying towards this payment plan. So down here, we're going to specify the insurance plan that's going to be attached to this payment plan. I'll go ahead and select Change, notate the plan here, and hit OK. If the patient had multiple insurance plans, a secondary, tertiary, or so on and so forth, you would see additional options here. But in my example, our patient just has the one. The date of agreement here is listed. And the total amount by default does pull, again, that total balance for this patient here. We know that this is not what insurance is paying towards, though. They're only going to eventually pay that $2,500, so I'll go ahead and update that now. We've gotten in our first payment today, so I'm just going to go ahead and update that to today's date. And for our date of agreement up here, while it's not necessary, I'm going to go ahead and backdate this to about when the work was done and when my claim was created. We're not going to list a down payment here. Instead, we're just going to enter in each payment as is. And for this example, we're not collecting any interest on insurance payments here, so nothing will be added in this example for the APR. Down below, if you can recall, there was an option to attach treatment credits to the patient payment plan, but there will not be so on an insurance payment plan. This is because the payments that we're posting will actually be posted on the insurance claim itself as the initial and supplemental payments, and the procedures are already attached to the claim, so there's no need to attach here as well. We'll go ahead and from here, we can specify either, again, the number of payments insurance is paying us or the payment amount that they'll be putting towards each payment. So the payment amount is $250. Again, that default for our schedule when we do create it will be a monthly schedule, but in this case, I know that insurance will be paying quarterly instead. So I'll go up to more options here and notate that it's a quarterly payment plan setup and hit close. So everything looks good on the left here. We have our date of first payment for today, the total amount that insurance is going to pay, the payment amount that I'm expecting each time. We're good to go ahead and create that schedule. All right, so here we have our schedule here, and again, it lists off each of the dates that we're expected to kind of see that payment come in here. And now with insurance payments, it may not always be exactly that date, but this kind of gives us a good idea of when we should be seeing that payment come in. So I've reviewed my schedule here and everything looks good. The last thing I want to go ahead and do is copy this number here that I have for the total amount. I can actually paste it down here in the treatment completed amount as well, notating that this is the amount that will eventually be attached to treatment when this payment plan is completed. And I'll go ahead and hit OK. All right, so as you can see right now, our patient's account does look a little strange temporarily. We have an insurance estimate still of that $2,500, and now the patient's estimated balance has gone away. Don't worry, we're going to go ahead and resolve that. So like I mentioned, today is the day that we've received that initial payment here. So what we're going to go ahead and do is double click into our claim that we've sent. And we're going to go ahead and enter the payment in by procedure. So I'll click up here in the upper right hand corner by procedure and notate that we've only received that $250 check, and then hit OK. From here, I'm going to go ahead and finalize as this claim only, enter in my check information here, and then select OK. I'll scan in my EOB, and again hit OK to finalize. And there we are. This automatically sets itself the way that we're wanting it to. What we can see at the top now is that insurance has paid that $250, and Open Dental recognizes that as being a part of the payments that we need for our payment plan. Everything is calculating correctly here, and I'll show you the breakdown. Again, what we're seeing here under the payment plan window is a snapshot of what we've created. Again, what we're seeing under the payment plan window here is a recap of what we've created so far. The date of agreement being listed as April 1st. The guarantor is listed as the patient itself, but we know because this is an insurance payment plan type that the guarantor is really the insurance carrier itself. The principal amount and total cost of this particular payment plan is $2,500. And so far, because of that claim payment I've just received, $250 has been paid. We still have a balance of $2,250 worth of insurance payments to go left, but at this time, nothing is due now until the next quarter. This effectively removes that $2,250 balance that would have looked like a patient portion due to the fact that our received claim would have assumed that insurance wasn't going to pay that. and it's moved it up here to the payments plan section, keeping it out of the patient's ledger. So this balance up here at the top, where we're seeing estimated $2,500, is truly that patient's balance that we know we need to call them to collect on. At this point, if we would like, we could go ahead and go through that process that we did earlier on Peter patient and go up to the top, select from our payment plan dropdown a patient payment plan, and go through the setup of a patient payment plan for that remaining $2,500 patient balance. All right, so for our last example here, I'm just going to go ahead and switch over to my last test patient here I have, Dinah Dynamic, and we'll go ahead and review the dynamic patient payment plan. So what makes a dynamic payment plan special, or what gives it the dynamic name, is a couple of different things. So for a dynamic payment plan, we're going to be attaching production instead, as opposed to just procedure codes. And I'll show you what that looks like here. The dynamic payment plan is dynamic in that you can continue to add to the total amount of the payment plan by adding production that you've either completed or treatment planned. You can remove it as well if maybe treatment changes for that patient and we don't need the types of procedures we previously thought we did. And lastly, when you receive an insurance payment on procedures that are attached to that dynamic payment plan, and insurance maybe pays less than we were expecting, the dynamic payment plan is going to adopt that leftover charge. So if insurance was estimated to pay $100, they only paid us $50 and we didn't write off anything else, that remaining $50 is going to be added to the patient's dynamic payment plan, and they will adopt that balance there and pay it off. All right, so let's go ahead and get started with a dynamic patient payment plan. The patient that I'm using here has a couple of procedures in their account. Currently selected a patient that doesn't have insurance, but again, like I mentioned, this is something that can be set up on patients with insurance. And if insurance underpays on a particular procedure or doesn't pay what we expected, the dynamic payment plan will reflect those changes, and the patient will either adopt that extra balance, or if insurance pays more than we expected, the patient will owe less too. So we have a $2,000 balance. We're wanting to have Dinah pay that off over the course of monthly payments. I'm going to set up my dynamic payment plan by selecting payment plan and then dynamic payment plan from the dropdown. All right, so now that we have this window here pulled up, we're going to go ahead and review the information here because this does look a little bit different than the previous payment plans we were working on. So similar as before, we do have the ability to set a category if we would like. Our listed patient is here, and the guarantor or person who's paying towards that payment plan is listed below. Dinah is paying for herself, so no changes need to be made at this time. Down below, we're going to go ahead and list our date of agreement. Automatically, it defaults to today. So our total payment amount, the box you can see here is grayed out, and we can't actually type anything in here. It's not populating either that $2,000 balance that we see before. What we're doing instead on a dynamic payment plan is we're going to go ahead and add the production we're wanting to pay off by using the production tab here on the right. I'm currently on the production tab, which you can see above. And down below in the lower right-hand side, we have the add button here. Selecting this button opens up a window where I can specify which production we're wanting to attach to this dynamic patient payment plan. As you can see here, we have those 3 procedures from the patient's ledger listed here. We also have a treatment plan procedure as well at the bottom. So you can attach completed and treatment plan procedures on a dynamic payment plan. I'm going to go ahead and attach everything that's listed here by highlighting them and clicking OK. And automatically, the total principal amount here populates based off of my selections for production. No changes need to be made here. Down below, I can go ahead and notate the down payment here. And above, the date of the first payment. Again, I like things nice and neat, so I'm just going to go ahead and have my patients charged on the 1st. We are going to go ahead and collect a down payment for this particular patient, and they are going to pay $775. We could collect interest, and if we wanted to do so, we could enter that in here for the APR. I'm not going to do this on this example, but we'll go ahead and notate down here what the monthly payment is going to be for this particular patient. So they're paying $775 up front, and then each month they've agreed to pay $375 as well. Previously, we did have the ability to select that more options button like we saw in insurance and patient payment plans. And we still have that same option, but instead of clicking a button to do so, we have our charge frequency listed right here. So I can specify if this is something I want to collect on weekly, every other week, a specific day of the month, monthly, or quarterly. I'm just going to go ahead and leave it with that default there. And now for the treatment plan procedure that I listed, this crown here that's $500 worth, we can go ahead and specify how we want our dynamic payment plan to reflect this charge here. Now, it can be attached currently as if that procedure was set complete, which means it's going to total out that full $2,500. Or if we would like, we can leave it to await procedure completion, meaning it's going to list out only the current charges that are completed. So these first 3 procedures, which tally up to $2,000, we're going to see just a schedule of those completed procedures and paying off those. Then once that 4th procedure is set complete, those charges will automatically add to this dynamic payment plan. So it's up to you how you want to handle that. If you choose to await procedure completion, again, you're only going to see the total amount in your schedule for what procedures are currently complete. And that can be nice. Or if you want to choose it to be your treatment planned procedures as complete, you're going to see the full amount for everything attached in the production tab on your schedule. Keep this in mind in case you ever need to make changes later down the line. If for whatever reason, maybe a crown was not decided upon for this patient, maybe they just chose to have their tooth extracted instead. If we do adjust off treatment planned procedures, if we remove them and change it to something else or just remove them entirely, that will affect the schedule that we've made here. And I'll show you what that looks like. So I'm just going to go ahead and treat all of my procedures as if they're complete, even my treatment planned one here. I've decided that the payment amount here is correct, $375 after that down payment of $775. I'm going to go ahead to the top and click the schedule button, or the schedule tab rather, and then I'll create the schedule. Now what you're seeing here is each upcoming charge, and it's listed here in gray. This is because the dynamic payment plan is flexible by nature, and everything that we have here is not currently set in stone. As each payment comes and goes, and the charge is truly posted on the patient's account, past items will show in black, showing its finite nature. But everything else in the future will continue to show in gray. So let's review this amortization schedule in more detail here. What we're seeing is a little bit different than what we're used to in the fact that everything's gray, but we're also seeing a description here of all of our upcoming payments. The first one here is our down payment here, and in the description, it actually specifies that our $775 down payment is going to go to the 7210 extraction code here. So the neat thing is The dynamic payment plan is telling you just exactly how each payment is going to be allocated to the procedures in the patient's account. On the first of a month, when we're collecting that $375 from the patient, it's actually going to split that $375 payment for us here. So $150 will be applied to the $23.94 filling code, and $225 will be paid towards that extraction code, paying it off completely. You can see in the future, additional payments after that will also break down in a similar manner. So it pays off one procedure and then begins paying towards the next procedure, and so on and so forth for the rest of the schedule. All right, so at this point, we've got our amortization schedule the way that we want it to. Our payment plan is correct. We can review the notes here and again, print out if we want to have a record for our patient to keep, and then go ahead and click OK. All right, so due now is that down payment of $775. So I'm going to go ahead and collect that here now. So I'm just going to go above to the patient payment window here and enter $775 here and OK. Automatically, when you're seeing this window pop up, it knows right off the bat that because that $775 is due now, like it's listed up here, it's automatically going to pay it towards the pay plan charge for today. So I'll go ahead and notate that this is a cash payment and I'll hit OK. All right, so because the dynamic payment plan is flexible, I did want to show you what that looks like here. So we've taken that $775 payment, down payment for today, but maybe the patient has decided that they actually did not want to have that procedure that we treatment planned, that crown that I attached at the end, done after all. So what I can do at this point is double click into the payment plan itself and open it up. Once we've gotten to this point, we're going to want to click the unlock button here. This allows us to make any edits and changes that we need to. Now at this point in time, I do also want to advise you against clicking the full lock box. What this does is it limits and restricts your dynamic payment plan so that it functions no differently than a patient payment plan, completely locking it and allowing no changes to happen to it. If this box is checked, there will not be the option to unlock it, and everything that you see here will essentially be set the way that it is. So to keep the dynamic payment plan dynamic, we're just going to go ahead and hit unlock, and we're not going to use that full lock option. All right, so production though. The patient has elected not to go with that crown that we treatment plan. So we're going to go ahead and just remove it from the dynamic payment plan here. I'm going to switch over here to the production tab, locate that particular procedure here, and then click delete. If I hit yes, that will remove it from the payment plan, leaving us with just the 3 procedures that have been completed. I'm going to return to the schedule tab and review the changes that have been made. So right off the bat, like I had previously mentioned, everything here in the future still shows as gray. But because we did have that down payment from today that we posted, this is now showing here in black, as well as the line item of our payment right below it here. So due $775 in black because it's permanent, and then the green cash payment of $775 listed here, making the current balance for a payment plan $0 with upcoming charges to come. Okay, I'll go ahead and hit OK here and save changes to our payment plan. Our patient's balance at this time is $0 here. They owe us nothing and will owe us nothing until charges are again posted on their account on the 1st. And that's all we have here for the dynamic payment plan. So now that we've covered the 3 different types of payment plans that we can have, the patient, the insurance, and the dynamic patient payment plan, let's cover real quick how we can close out a completed payment plan. So I'm going to go ahead and locate my patient here who has recently paid off their payment plan. They've sent us a check for the final payment, which is due now, $125. At this time, I'll go ahead and process that payment by clicking in the payment button, entering in the amount, and hitting OK. I'll go ahead and enter in my check information here and verify down below that the payment for $125 is going towards our payment plan. Accepting the payment, I'll go ahead and hit OK. As you can see now in our payment plan section, the payment plan shows a balance due now of $0, balance remaining also $0. What they have paid towards equals the total cost of our payment plan, which is $500. Since the patient will no longer be paying towards this payment plan, we can safely close it out. I do want to make a note that if we were closing out a payment plan prior to the patient having paid the full balance, whatever was remaining on that balance will be dropped down to the ledger for the patient to pay or for the office to choose to adjust off if necessary. But let's go ahead and close this one out. So we'll double click into the payment plan. And as you can see here, up in the amortization schedule, we do have a payment listed for every charge posted. The balance at this time is $0, zero remaining to pay off. So closing this plan will move no charges to the patient's ledger as there is no remaining balance to cover. Closing a plan is simple. All we have to do is click the Close Plan button. Again, as I've reminded you already, any future charges or remaining balances would be due immediately and posted on the patient's ledger, but since our patient here owes nothing, we can go ahead and safely hit Yes to continue. As you can see, once closed, the payment plan section of this patient's account information is no longer showing. We can see the balance here and go through each of the different line items. And as you may see that each of the credit card payments and check payments that were initially attached to the payment plan are still listed, as well as the charges for that payment plan as well. Now, if we want to reveal or review any of our closed payment plans, all we have to do is go over to the Show tab here on the right and check the box to show completed payment plans. Our payment plan window does show now, and you can see the previously used payment plan appearing here in gray. Under the Due Now column, it does show that the payment plan has been closed. I can double click into it to review the information. However, this payment plan, being that it is closed, must be reopened if I need to make any edits or changes. To reopen a payment plan, you can click on the Reopen button here and edit the information. But at this point in time, with everything being paid in full and no balance remaining, there's nothing further that I need to do to this payment plan. It will remain in this patient's account as historical data, but able to be accessed at any time. So that's all I have for payment plans. I'll go ahead and uncheck this box here to return the account ledger to just a standard patient account. None of that historical data showing. And we can proceed with normal. And at this time, all we see is any current charges that the patient may owe.
Thank you for joining us for today's webinar. If you have additional questions, please call our support line at 503-363-5432 or access our complete online manual at opendental.com. And to make sure you're staying up to date on our latest training videos, make sure you subscribe to our channel and turn on notifications.